Hello, I'm Cindy Arenberg-Seltzer, President and CEO of the Children's Services Council of Broward County. Welcome to another edition of Future First, Focus on Broward's Children. We've long known about the dangers of using alcohol and illicit drugs during pregnancy, but over the last decade we have seen a dramatic increase in prescription drug abuse during pregnancy. Today on our panel we have experts who will discuss the medical, social service, and therapeutic challenges for the substance-exposed newborns and their families. I'm joined by Linda Welp, a registered nurse who supervises the Healthy Start, Healthy Families program at Broward Health, Toula Zoulas, clinical child therapist at the Susan B. Anthony Recovery Center, and Sam Brown, responsible fatherhood program coordinator for the Healthy Mothers, Healthy Babies Coalition of Broward County. Later, we'll hear from Melodee Putt, a grandmother who is raising her two granddaughters because of their mother's issues with substance abuse. Welcome, everyone. Thank you for being here.
Thank you.
Linda, I want to start with you because you've been in this business a long time and you've really seen this change in the prescription drug abuse happening and its effects right there at the hospital. Can you talk a little bit about what you've seen?
Absolutely. I mean, years and years ago, certainly illicit drugs and alcohol, we knew that, that they were a huge risk and danger during the pregnancy, and they still are. But what we've seen in the last decade, particularly since from 2004 to about 2011 in Florida alone, we've seen almost a 500% increase in the use of prescription drugs or prescription drug abuse during pregnancy. Nationally, in the United States, prescriptions for drugs for pain relief probably are one of the most written prescriptions in the United States, so they're readily available to everyone. And it's not like someone's out there saying to a woman, well, if you get pregnant down the road, you're taking this medication for pain. Recognize that you won't be able to take this medication while you're pregnant.
What are the doctors doing? Why are they writing scripts for medication that could put the infant or the fetus at risk?
Well, generally the woman's already on the prescription. She might have had an orthopedic procedure or whatever it might be. She's on the prescription, and they're not making the connection that down the road she may actually get pregnant. And she's got a prescription, so it's a valid reason to be taking that medication. And over time, there's dependence on these drugs. And she may not make the connection that this can be harmful to her baby, or due to her addiction, she may not be able to make the decision that she needs to stop using that medication while she's pregnant. And we don't really know the long-term effects on the fetus, on this newborn, that are going to occur due to this long-term exposure. And every woman uses differently during her pregnancy, so each baby isn't exposed to the same amount of these types of drugs, and every baby metabolizes it a little bit differently. So when the baby's born, they don't all exhibit signs of withdrawal at the same time, and their symptoms aren't all the same all the time. I mean, generally you'll see signs and symptoms of withdrawal by about 5 days of age. But as we all know, if they've had a normal delivery, most moms and their babies go home after the second day after delivery. And if they've had a C-section, by the third or fourth day. So a baby that's showing signs and symptoms of withdrawal very early on, it'll be observed in the hospital and can be addressed. But for the babies who don't show those early signs, those signs and symptoms might not be observed until the baby gets home. And if the parents aren't educated on what to look for, or even make the connection that their baby has been exposed and is dependent on those drugs that they've been taking, they may just think they have a colicky, fussy baby. And these babies have real needs and they need to be addressed.
And that can also, when you have a really colicky or fussy baby, that can lead to abuse as well from a stressed out parent. So we have multiple problems going on here.
These babies are more at risk of abuse and neglect, much more so. And the prescription, what we're seeing with the prescription drug abuse, it's actually called, what they're terming it today is neonatal abstinence syndrome, and it's a group of signs and symptoms that are seen in a newborn after birth if they've been exposed to prescription drugs or illicit drugs like marijuana, cocaine, heroin. And the signs and symptoms aren't the same for every baby, as I said, but I mean, they could be very irritable, they could have tremors, they could act like a colicky baby, they don't feed well, they have loose stools or diarrhea, they can have respiratory problems, they can have seizures. If a mom were to stop taking these medications during pregnancy, just abruptly withdraw them herself, she doesn't make the connection necessarily that that baby has had an abrupt withdrawal as well. And that poses great risks to the baby. I mean, the babies are at huge risk if a mom is withdrawn off very quickly. They could have seizures in utero, there could be fetal death. That's why generally a woman who's put into treatment, she may be detoxed throughout the pregnancy, but she's not detoxed in a way that she's taken off of everything. Generally, she's detoxed and she's placed on methadone. And that is still an opioid. But what it is, it's a controlled withdrawal over time under the care and supervision of a physician. And then that baby's still going to be exposed at birth. And the babies that have real issues that really show signs of withdrawal in utero, those babies are transferred to our neonatal intensive care units, and they're monitored in the units. There's a very specific scoring system where they look for specific signs, and if the babies have a certain score, then they begin treatment. There's non-therapeutic treatments that are comforting type of treatments that they might initially start with. But if a baby gets to a certain score, they're going to begin drugs like at Broward Health, for instance, in our NICU, we use any combination of possibly morphine, phenobarbital, clonidine. Occasionally we use methadone, but we use morphine more. And people might say, well, you're giving these things to the baby, but you have to gradually withdraw these babies off. So you can't expect them, right? And they're at more risk if you do withdraw them abruptly.
So the Susan B. Anthony Recovery Center deals a lot with women. It used to be more alcohol, but now I think you're also seeing these families come in, these women come into you. What are you doing, Toula?
A lot of the women that do come in, initially come in, they meet with the developmental specialist, and then the children that come in that are 2 years and older will meet with myself. I'm the child therapist there that sees a lot of children who are actually exhibiting attachment difficulties, which is, the cornerstone for them to develop relationships later, attachments to their mothers, because they hadn't been able to form this while their mothers, either were at the time using, or while they were pregnant, they didn't even have the support, themselves. Another major problem that these children are having are adjustment issues, like adjustment disorders due to them moving around or the parents not having a stable environment and social support to help them, through this process. And we hear it all the time that a lot of the women that do go into hospitals to give birth just go alone, and they don't have anyone with them at the time.
What brings us to Sam and the Fatherhood Initiative.
Yes.
Mm-hmm. Sam, what are you doing with those fathers to try and help them stay involved in their mothers' lives?
Well, I'm just constantly meeting with the fathers, doing one-on-one case management and expressing the importance of their role to be there to support that mother. Just letting them know different things, like when they're not there, she's going to look to someone just as if their children are, at them not being there as a role model for the children. You have to be there to support the mother, whether you're in a relationship or not. Just understand that is the mother of your child, and you need to care about her and the things that she's doing. If she's using these drugs, you need to be there to tell her that it's wrong. You need to be there maybe to keep her busy or do activities so you can constantly talk to her and get in her head and let her know the different type of aspects and risks that she's putting her child at.
Are you seeing a change in behavior on the part of the men that you're working with?
Just to be perfectly honest, it's a slight change. I mean, it's definitely a work in progress. But, I just go out with the attitude, if I can touch 1 to 2 fathers out of 100, then, soon it'll be to 100. So, just to be perfectly honest, it's a challenge, but we have fathers that are stepping up to the plate and doing the things that they need to do.
And are you seeing a change in the women when the fathers are there to support them? Does it help?
There is a change. The problem, I think, is having them trust the fathers to be there consistently. I don't know if you saw this, but they may show up for a meeting or for a session, or if I do like a group session with mom and child and ask the father to come in, and then to follow up, it's hard for them to remain consistent. I think that's the biggest issue that I've seen with these women, you know, having the men or the fathers of these children remain consistent in the treatment or in the therapy or being there as a support.
The family support, whether it's the father of the child or perhaps the mother of the mom.
Exactly.
Or that whole family system in general needs to be able to support this expectant mother and help her through this process. So what's it like when the issue hits home? Let's hear from Melodee Putt, a grandmother whose life has been radically changed since becoming the primary caregiver to her daughter's children, one of whom was born substance exposed.